needle-free technology, reducing the amount of needles in practice, is not only from a safety standpoint. We do know that chronic exposure is certainly something that we have in the veterinary space to hazardous drugs, radiation, other hazards. Being able to reduce the amount of needles is something that we can do easily. It's going to end up saving the facility money long term because we're not going to be using as many consumables. And it's just better quality of medicine. It's better standard of care. In order to identify the areas where we can reduce those needles, the staff really kind of have to look at certain applications. There are some instances where you can't take a needle away. Placing an IV catheter, giving an IM injection, you're going to have to use a needle for those types of things. But there are things with IV fluid therapy, drug preparations out of multi-dose vials or multi-dose bags. Those are certainly ways that we can reduce the amount of needles in the practice. It's always interesting when I ask technicians, when I lecture about going needle-free, and I always start that lecture with how many people in the room have stuck yourself with a needle at work. And every single time I've given the lecture, 100% of the people in the room raise their hands. So we know that it's a problem, and we know that it's something that exists in veterinary medicine, but unfortunately there's this kind of safety lapse and thought that just because we aren't working with people and some of the bloodborne pathogens that people may pass on, that it's not as dangerous, and that's just not the case. And we're starting to see that a lot of that previous thought process and belief is changing, and people are starting to understand that this is a much bigger problem than maybe they had previously thought.